Hello, my name is Florenz Baltazar, and my infomercial is going to be on annual physical exams. Introducing the physical exam, it is done every year to check in at a person's health and to see where they are in terms of their physical health. There are many parts to a physical exam and is usually done by a doctor and sometimes even by a nurse practitioner. Physicals are generally the same for everybody, though some people might need extra blood work or extra tests depending on if the doctor needs it. Men and women have different exams when it comes to their reproductive organs. So when a person shows up for a physical exam, they have to go meet the nurse first. And what the nurse does first is discuss the medical history. They check for allergies to make sure which medicines a person can have. They check if you smoke to see if they need to closely monitor lungs and breathing. They also ask if you are sexually active to see if they need to test for STDs or STIs. And they also ask how active you are to see if you're getting the right amount of physical activity and exercise. The nurse goes ahead and checks your blood pressure. They check your temperature to see if you're at a normal range. Height and weight is checked to see where your BMI is and to see if you're at a healthy BMI. Sight and hearing is usually for the minors, but the nurse does the eye test where they cover one eye and sees if you could read the board, and the ear test to see if you could hear the sound coming out of the headphone. Later, the nurse follows up on the vaccines you need and asks if you wanted to get them after the physical, but this is completely the patient's choice. Moving on to the doctor's office, the doctor will start by checking your heart. The doctor will take out his stethoscope and put it in front of your heart to check heart rate and make sure that your heart is fine and healthy. Then he'll move on to the lungs and the breathing portion of the exam, which involves him putting the stethoscope in front of your chest and in your back and asks you to take deep breaths to check for abnormalities in breathing. After, he'll get the skin and visual exam, which is looking at the skin for rashes, lumps, and irregular spots because these could be signs of cancer and other diseases. Then he'll go to the reflex exam, which is getting a little hammer and hitting the knee to see if it reacts. This is just to check if the reflexes are intact. And then we'll go to the eye exam, in which the doctor flashes a light in your eye and asks you to follow the light, while the ear exam is looking into the ear to make sure it's not infected or damaged. Then it comes the neck exam, which is checking the lymph to make sure it isn't inflamed or acting up, and it also checks the thyroid area to make sure that it's a certain shape, and this is done so to make sure that there's no thyroid problems or problems with the immune system, since the lymph is in charge of that. Physical exams are different for both males and females towards the end of the exam, since they have different reproductive areas. For females, a breast exam needs to be done, and it looks out for abnormalities in the breast to see signs for breast cancer. They also need a pelvic exam, which checks the vaginal area and the female reproductive organs like the ovaries and the uterus. They look out for STIs or STDs and also for cervical cancer in the cervix. For the males, they check the testes by checking the tenderness and size changes. They usually look out for testicular cancer here. And then they also check the penis for any warts, STIs, or STDs. They do a prostate exam, which involves inserting a finger in the rectum to see if the prostate is functioning fine and to see if there are any signs of prostate cancer. Lastly, they'll check for hernias, which is also called the turn and cough exam. And this checks for problems in the abdominal wall near the intestines and scrotum. After the physical exam is done, we move on to the post-exam, and the post-exam is just anything the doctor recommends you see or do after the physical to completely make sure they didn't miss anything. They could recommend a simple blood check for cholesterol and blood sugar levels if you may be overweight or diabetic, an STD test if you are sexually active, maybe they found like warts or something weird in your reproductive area, A visit to a specialist, like the eye specialist or the hearing specialist, to see if they found any problems in the eye, ear, or even the thyroid or lymph specialist to see if your lymph nodes were acting up. And they could give medicine prescriptions if they see fit, like let's say you're having trouble with your allergies, they could prescribe like Benadryl. They can also call someone to give you a vaccine shot if it's due, but this is completely the patient's choice and they could always say no. So that ends it for our infomercial, and I thank you for watching, and hopefully you're prepared for your next physical exams. And this page is the reference page of the websites I use. Thank you!